Hi, everyone. Thank you so much for joining us for our webinar series. Today, we're going to be talking about male testosterone replacement. So, we appreciate you all carving out a little bit of time out of your day to meet with us.
I just have to say really quick, I had so much fun creating the PowerPoint
Yeah.
because we like came up with this hormonal heroics
Yeah.
and it was like super band. That's what we want our guys to feel like, right? It's like super powerful.
Absolutely. Absolutely. Who doesn't want to feel and look like Clark Kent?
Hello.
So, just a little bit about our practice here at Your Beautiful Aesthetics. I'm the owner, Jen Collins. I'm a nurse practitioner and have been for about 11 years, I think. I gotta do the math. And I established my business starting off with just aesthetics in 2017 and worked previously at Derosa Medical, which was primary care and hormone replacement for men and women. So I really had a great opportunity to train under like the hormone guru, Dr. Angela DeRosa. And then after that practice closure, decided to just take up hormones in my own practice that I had already established for aesthetics. So it's been wonderful. And I just really enjoy being able to help both men and women feel good and in a natural way, and also help them with their confidence, with not only looking good with aesthetics, but also feeling well. And then I was lucky enough to get Christina. I kind of snagged her, like stalked her for several years, and like, when are you gonna come work for me? And then it finally worked out. And I'll let you tell a little bit about
Yeah,
yourself here.
thank you. Hi, everyone. I'm Christina Johansen, nurse practitioner. I too worked with Jen. Actually, that's where we met at Mayo Clinic Hospital. I worked there for about 6.5 years on a transplant unit. We did solid organ, kidney, liver, pancreas. Super loved it. I've been a nurse practitioner now for about 7, 8 years. Have been in primary care, urgent care, walk-in clinics. I too also got to train under Dr. Angela DeRosa and worked at DeRosa Clinic with Jen as well. Was there for about a year and decided to be really spontaneous. Moved to Colorado for a few years where I practiced out there. Met my now husband, and fast forward, we have an almost 3-year-old and I have 15-month-old twins. So life is nuts. But to Jen's point, she did kind of reach out a couple times. And finally, I was at a space where I was like, okay, I need part-time work, but now I'm working 4 days a week just because I love it so much. And I'm so grateful and thankful to be a part of Your Beautiful Aesthetics, where we can work on female, male hormones, work on aesthetics. So I'm very thankful that you brought me on. So thank you.
So,
Here we go. All right, so to jump into it, we have some fast facts to talk about with male testosterone. Certainly, it's made in the testes. It's actually a hormone that's important and affects our sexual development, our libido, muscle and bone growth, and of course, our mood. It does play a role in fertility. Testosterone levels, I love this image because it shows you that levels peak during adolescence and early adulthood, and then men lose about a percentage of their testosterone each year. So you can see by the age of 80, they are incredibly deficient. So I just thought that that visual was a really good one to kind of see the impact that aging, of course, has on our overall testosterone levels.
gotta love that age.
Good old.
All right. So traditionally, testosterone deficiency has been kind of defined by lab levels. And if you ever look at an actual lab range, it goes from about like 280 or 300 up until like 900 is normal. So that's quite broad. And in the past, insurance, we really had to fight them on coverage, and males had to have two separate serum blood levels less than that 300. And so that was how they defined it. But really, men can feel a decline even at a range of like 500 or even 800. And just to give you a reference, we do like to treat a male into a range of 800 to 1,000. But some men, we tie it into like their symptoms and the overall picture with whether or not we decide for treatment. But actually, treating a male with testosterone is it's amazing to see the transformation, and we do see it. We see just everything improve, from their mood to their overall muscle mass and just their sleep and everything. It's amazing.
Yeah. So some symptoms regarding low testosterone are really there's a wide range of them, and some of them do overlap with some other medical conditions. So it's really important that we kind of take a good listen, and we also do some additional blood work. So certainly you can experience low energy, low motivation, low desire, fatigue, maybe mental clarity. You're not feeling quite as sharp, a lot of brain fog. Certainly anxiety, depression, trouble sleeping, like Jen mentioned. You can have problems with your libido, trouble maintaining and sustaining an erection. You can have inappropriate weight gain. Maybe you have breast tissue enlargement. We talk about women going through menopause, and men go through their own andropause as increase in age.
Menopause.
Menopause, yeah.
Menopause.
As you increase in age, your testosterone levels decline and your estrogen levels go up. And so you can have your own hot flashes and night sweats. You can have, that irritability that comes along with it and increase, as well as decreased bone density as well.
So, and there are actually some medical risks associated with a low testosterone as well. Testosterone plays an important role in our cardiovascular function and just like the strength of our heart muscle and the our blood flow. Also, it's linked to thinner, weaker bones, so a risk for osteoporosis and fractures as we age. Reduce muscle strength and size, midsection accumulation of fat, infertility issues, and a low sperm count. So that if you're wanting to start a family and having sometimes it's due to a low sperm count for the male, also can be linked to metabolic disorders like type 2 diabetes and just a risk of that goes along with it being overweight and all the comorbidities associated, high cholesterol, and then just increased risk for anxiety, depression, and low motivation.
Yeah. So talking about estrogen, so when we talk about, estrogen, if for a man, a lot of people are like, wait, what? Because they associate it with being a female hormone, and it is predominantly, but we need to have a fine balance with testosterone and estrogen for a man as well. So I like to kind of use not the analogy, but men are about 90% testosterone and about 10% estrogen. And some men, as they mature with age, they overconvert and they start to get this imbalance where they have too much estrogen. And so we got to find the balance there because, estrogen can actually be really helpful for supporting our bone health, helping with the ability to maintain the erection, also part of sperm production as well. So we really want to make sure we find that balance. And that's where blood work kind of comes in, talking about your symptoms. If you're having symptoms of those estrogen, excess type of symptoms, and we really need to talk about blocking that down with certain medication.
And also, just to add, we do check a baseline estrogen level, and a lot of the times men at baseline are converting too much estrogen, and so if the more testosterone they get when we raise their testosterone, most likely they will convert even more estrogen. And they've actually found that estrogen can be associated with, or an excess estrogen, I should say, can be associated with like prostate cancer in men. So that's been studied.
Yeah, and then if you have too much estrogen on board, you're not really going to get the full therapeutic benefit of the testosterone. So it's really important to monitor closely.
And really, it's just a pill that you take. We just block it down with a pill that you take weekly. So super easy and affordable. So sexual health is very important for a male and also for relationships, having closeness with your spouse or your partner, bonding and supporting more commitment and just satisfaction. We get a lot of females and males that actually are our patients, and they end up referring their partners as well because we also if there's a mismatch there, that can also be a huge problem in the relationship. And for men to have a good erection and to sustain and, have, I guess, success in the bedroom, but they need testosterone, to help with libido and actual erection. And then blood flow is the other thing. So sometimes we will incorporate medications like the Cialis, Viagra, like the vasodilators to help with that. So we do talk about that as well. And we're as uncomfortable as it can be to talk about, we are very much, creating an open environment where we'd like you to feel comfortable because we do feel that it is an important issue and we're here to help.
Yes, super important. So some therapeutic benefits. We've kind of talked about them, but it's, we can help with improving cognition and memory, improved energy, motivation, that clarity of thinking. So when we replace testosterone, you'll get a lot of improvement in these symptoms. Sexual health, like Jen just talked about, confidence overall, right? Improve sleep quality, quality of life. And then certainly we have seen improvements with muscle and bone health, redistribution of fat where it's supposed to be. Testosterone helps pull sugar into the muscles and not the fat, so you get a lot more benefit with working out. And then with all that being said, we have an improvement in our heart health. We improve our circulation, we improve blood flow. So how we kind of approach testosterone therapy for men here at Your Beautiful Aesthetics is we want to create an individualized approach. So we want to really listen to your symptoms, listen to your concerns, and be able to create a customized plan of care that's developed just for you. We're going to look at personal history. We're going to look at family history. That becomes really important. We'll do a physical exam, talk about your symptoms in detail. As uncomfortable as it may be, it's very important for us to know all the ins and outs. And then we'll do some blood work. So we can also do saliva and urine testing, but we primarily start with labs. The nice thing is that we can actually do your labs here for low cost. We also do have the ability to order labs through Sonora Quest or LabCorp. So you can see if your insurance will cover some of it as well. So lots of options there. And really with the lab work, what we're trying to do is, as I mentioned, those symptoms of low testosterone can kind of bleed into some other chronic conditions like thyroid issues or vitamin deficiencies, diabetes. And so we really want to make sure that we're looking at the full picture to make sure we rule out anything else that we need to be aware of and treat those appropriately or refer back to your primary care provider. And then certainly take a look at the overall associated risks with testosterone. There's a lot of risk, but there's a lot of really great benefit. And so we have to make sure we do our due diligence to look at that full picture and make sure you stay up to date on preventative exams like prostate levels and all that.
So there's several delivery methods for testosterone, and it can even start as like just boosting your own testosterone levels. So the compound pharmacies that we work with have developed different compound medications, meaning that they like are customized meds that can actually build your own testosterone. So with things some like Clomid and DHEA and adrenal type supplements to actually boost your own levels. And we actually do see improvement of those levels and people feeling better. So a lot of the times this may be a good option for someone that's younger or that maybe is desiring fertility. Or maybe they just want to not just dive right into testosterone, but doing things like a booster. There's also a lot of peptides out there that we'll get into in maybe another webinar, but there's a lot of peptides that are natural that can also boost your levels. We can also do a compounded cream or a sublingual that are made at these compound pharmacies. And when I say compound pharmacy, you have your Walgreens and CVS and all that, but there's several really amazing compound pharmacies in the Valley, and we even work with some in different states that have real smart, like pharmacists. Yeah, really amazing pharmacists. And these pharmacies are FDA regulated, very much so to make sure what they're doing is safe, but they're able to do things that are kind of outside of the box, and they're really amazing, and they've really made big strides.
And I feel like they're even more regulated with like all their quality control and insurance, and it makes it even harder, I feel like, for the compound pharmacies to like stay afloat and do what they need to do because they're under such strict guidelines.
Right. And even they do their own studies within their own clinics as well, and using third-party studies. So like a cream can also be sent to your local pharmacy, and it can go through your insurance, like the different testosterone creams for men or gels. But the compound pharmacies can also make those and also in the form that you would do under your tongue. Those are a daily medication though. There's the most popular option really for us in our practice are the injections, which we establish that it's going to be safe for the patient to do their own home injections. We do have a strict come in every, 2 to 3 months so that we can watch your levels, get your blood pressure. Like we do hold you to that, to make sure we're really watching you closely, and make sure that you're comfortable with doing the injections as well. These can be both commercially made or compounded with MCT oil or different things like grapeseed oil. And then the pellets are procedure done in the office. So sub-Q, or I mean, sorry, in the fat. And so this is a procedure where we lie you down, numb you really well, do a sterile procedure, and insert the pellets under the skin. And the pellets actually will kick in and dissolve over the next 3 to 4 months, causing like a nice, steady incline and sustainability of the hormones. So there's a bonus of not having to take something every day. And then we tell our patients, you may be sore for like up to a week. There may be bruising, and then there's some precautions. We don't want you to be like soaking in a bathtub or a pool for like around a week actually, so that there is no risk for infection with just like creating a moist environment, and then that you're limiting lower body activity and exercise, so that as far as repetitive motion, you can do normal things like hike, golf, you can do your normal things, but if you're doing a pounding motion, then it can cause the pellets to work out. And then there's a risk for infection and extrusion, which is higher if you're diabetic, where you have high blood sugars that feed an infection, or if you're a smoker. So we look at all these different risks, and also for men too. Men don't always have like a very big booty. Yeah, so we actually
Gonna say that.
like the men. We like big butts. That's what we say.
Yeah.
Yeah. But some men are really thin and they don't have a butt. And so that can be a little bit harder because they do get more pellets, when compared to a female, that we need something for them to stick into. So that might make our decision whether or not pellets would be a good option. But overall, our men on the pellets do great, and it's a really nice, easy thing for them
I was
to
going to say,
do.
yeah, a lot of
Mhm.
people switch from doing weekly injections or something daily
Mhm.
to the pellets because you get them inserted, you kind of forget about them for
Mhm.
3 to 4 months, and then you start to kind of notice a burn off. And with the pellets, it is a lot easier to manage and follow blood work on it as well. So we get a
Right.
little bit more of an accurate representation of
Mhm.
where your levels are at, because it's basically all being controlled and released based on your brain and your body's need for it. So versus like the troches and the cream where they're metabolized throughout the day very differently,
Mhm.
lab work on that is a little bit harder to kind of follow.
Yeah.
And so for creams and troches, we do a lot of dose adjusting based on symptoms and how you're feeling.
Mhm.
So yeah, pellets are just love pellets.
So there are some side effects associated with treatment, and these can be androgenic in nature. Like a male may complain of some acne, which for a man who hasn't had acne since he was a teen, that's like not cool, right? Like, what is it? But but there are things that we can do to help with this. And then anyone that has like sleep apnea, like they can be at risk for like worsened sleep apnea. So, that may be just a discussion that we have. Sorry, there is a glare on my glasses. I can't do it. I'm just gonna try to read this without,
I got your back.
so we just assess that, and that they're treated for sleep apnea if that is the case. Decreased fertility, and the fact that testosterone does decrease natural sperm production. So if a male is, wanting to start a family, then we may put them on Clomid, which you may recognize from being like a female medication for fertility. It actually helps stimulate the follicle for men as well to produce more sperm. Yeah. So that is something that we can, although we're not fertility specialists, that is something that we can do, because if they are wanting fertility, then we wouldn't want them on testosterone, but then they're not going to feel well if they have those low testosterone symptoms. So Clomid can get them up about half of where testosterone would. So and that may even be covered through commercially through insurance. High blood pressure is something that can happen with testosterone, so we are always watching that and checking levels as well, especially in someone who has high blood pressure. At baseline, but testosterone naturally builds red blood cells. So the portion of the blood that is oxygen carrying and helps our organs, and
it's really healthy.
Yeah, it's healthy. So I've actually seen some patients that are anemic, and that testosterone is like giving them so many benefits. But in some men more than others actually are more prone to that increase in red blood cells. And when that occurs, there's actually too much blood circulating in the system. So then if they have too much blood, then their blood pressure is higher because of more blood. And then also they can be at risk for blood clots and other cardiac events. So we do, sometimes we'll even assess that cardiac function or refer, to a cardiologist if we want to work that up, or we do have an EKG. And Christina and I are both well versed in cardiac. So we may help rule that out for you as well. So we're all about safety. For prostate, we're checking PSA levels. So the prostate specific antigen is a blood draw. It tells us if there is inflammation with the prostate. It doesn't tell us if you have prostate cancer, but it tells us if there's inflammation. And so if and it may be because of just like a benign enlargement. Sometimes we can see that your PSA might be elevated after intercourse or with different inflammatory conditions, or maybe you have a urinary tract infection. But and then worst case, if it's elevated due to prostate cancer. And if you do have prostate cancer, testosterone can feed that cancer. So that's something that we're going to check, maybe not every time on you, but at least every 6 months, we're checking that number. So just in our experience as practitioners, we've actually found in the hormone realm that we've actually caught cancers sooner than a lot of other doctors may because of how often we are checking it. So, and so we definitely look at family history on that as well to see if that is more of a risk.
And I was going to just add that if there is, you've been on testosterone therapy, you have that abnormal PSA that comes back for the first time, we're going to continue to trend it. But, push comes to shove, if it continues to remain elevated, we might have to pause testosterone therapy, get you to the urology specialist because we're not the urology specialist and they need to work that out a little bit more. Again, we go back to safety. We want to do our due diligence to keep you safe and healthy. So if it is a problem and it is consistent, then we're going to get you to the right person to fully look at it.
Absolutely. And then even if it's ruled out, we want to, okay, from the urologist, like, okay, we're good to start treatment again. And then, so a side effect that we can see sometimes with testosterone therapy is fluid retention. There can be some fluid, like that pulls into the muscle, with testosterone. So when that happens, it's usually maybe at first when we start treatment and then it kind of balances out, but that's something that we can definitely manage and it's, definitely manageable. And then as far as the pellets go, there can be risk of infection, extrusion, injections really too. There can be a risk of bruising, or if you inject into, not a muscle or you hit a nerve. So that's why we, educate you on that. And then I guess you could call it side effects. We could also call it symptoms of low testosterone, could be the mood swings and irritability. But sometimes if the testosterone level is too high or you just absorb it too well, then you may actually feel kind of irritable or moody, have some road rage or something. So, and we're not, yeah, right. Yeah, it's some testosterone. But it can also be, like if you
are due for hormones.
If you're due for hormones, exactly, or if your levels drop. So so we listen to that when you come in each treatment and try to balance that as well. We're not trying to get anyone raging. Like we just want you to feel well. And we're not trying to, get you. I mean, we do have some men that may do body competitions, but like that's usually not the goal of most of our patients. Most of our patients just want to live their best life and feel well.
I just love when people call and they're like, my husband needs to come in, he's due for his hormones.
Yes, right.
Because they start to feel the burn off and they're feeling kind of moody. So we always can tell when someone calls in, they're like, oh, you need to see so-and-so soon rather than later. So we didn't really mention it at the beginning, but there is a chat feature that you can use to type in any of your questions. I'm going to pull that up now just to see if there are any that have populated. So there's some questions here, Jen, if you wanted to.
Yeah, so some people may ask, like, what happens if I don't like the side effects of the testosterone? For one, if we stop treatment, the hormone, it will wear off. And so, but typically we don't recommend like, okay, just stopping it, that we can adjust dosing. Sometimes it might be like finding a better option for that male, or changing delivery. But even if you have side effects of the pellets, we've never, nor would we like try to go in and dig them out. It's not, the risk would not outweigh the benefit of that. If you have side effects, we typically can very well manage them. And really for men are used to having testosterone. Like typically, the side effects are not bad for a male.
Right. And the nice thing about pellets is they do, like you said, wear off over time. They fully disintegrate, and time is on our side.
But yeah, usually you won't want to stop. Like, that's
No,
not typical.
no, absolutely not. Yeah. And I feel like another popular question is, can I start off on one and switch to another later?
Mhm.
And that certainly, I mean, at the end of the day, it's your body, and
Mhm.
we're here to help kind of guide you along the way. And you certainly can start off on creams and troches and then move over to injections or pellets. So
Yeah.
you do have that flexibility there to figure out what is the best route for you.
And also, everyone's a little bit different. So even each time we see you, we're kind of customizing dosing. Like we have some men that are even like they're like a bigger guy, but they do better with a low dose. And so that's where we keep them. And but then some men that need a higher dose, and as long as that's safe, then so everyone's different. We are not cookie cutter by any means.
And another popular question is, can I use my insurance?
Mhm.
The short answer is no, we don't really take insurance here at YBA. Like I mentioned previously, though, if you do blood work, we can certainly give you a lab order to Northwest or LabCorp, and you can see if your insurance will cover some of the cost. But we do accept HSA and FSA cards for services here.
And then also with different like the pharmacy can sometimes
Mm.
run your insurance too to see if like the injections are covered. Even the compound pharmacy can actually run insurance for that if you choose. A lot of the times we feel though that what our pricing is here is pretty comparable or and
Yeah.
affordable, and doable for patients. So
Doesn't look like any other questions came through. It's been about 30-ish minutes. So certainly on oh, thank you. Get out of here. Some special offers that we want to say thank you for joining the webinar today. You get $50 off your next hormone appointment. If you refer a friend, you will also get $50 off for another new service at Your Beautiful Aesthetics. That could be weight loss, it could be body contouring or aesthetics. So we just really want to say thank you for joining us. This last slide here just is our contact information. So if you are interested in scheduling an appointment or you're due for a follow-up, there's our office address and our phone number. There is, if you have your phone ready, you can scan that QR code. It'll take you to our social media page, which links out to our link tree where you can schedule online and get connected with us that way.
yes, thank you all so much for joining. We look forward to seeing you in the practice.
Thank you.
Have a good day.
Bye.